What are fibromyalgia symptoms? Is it all about pain? Does fibromyalgia cause a specific type of pain? I'm going to answer these questions for you and in the process share a really vital, potentially life-saving natural tips with you that anyone experiencing fibromyalgia or pain can immediately use in their life. I am Dr. Smita Naram, co-founder of Ayushakti, and we have helped more than 50,000 clients recover from fibromyalgia in last 36 years, using wisdoms from 2,500 years old Siddhaveda lineage. The symptoms of fibromyalgia are often thought of as being solely pain, a bit like saying my arthritis is flaring up. However, fibromyalgia is actually about much more than pain alone. There is, in fact, a long list of fibromyalgia symptoms involving various bodily systems. Pain in fibromyalgia might feel like the pain you get when you have the flu, or it can be a deep muscular pain, shooting pain, searing pain, or stabbing pain, and it can be even throbbing pain. In fact, some people are so sensitive that even the tiniest touch on their skin can be painful and can produce discomfort. As you can see, people have quite distinct pain experiences in fibromyalgia. However, you may be shocked to hear that pain is simply just one of the several symptoms of this problem. Fibromyalgia symptoms now include chronic fatigue, neurological symptoms, gastric and cognitive impairment. Many individuals experience exhaustion in their daily lives, but fatigue with fibromyalgia is on another level itself. It's sometimes described as profound fatigue. People frequently wake up tired, and this interferes with most everyday tasks. Even if persons with fibromyalgia can sleep, they frequently do not receive deep sleep or wake up late at night, unable to return to sleep again. The cognitive disturbance, often known as fibrofog or brain fog, is characterized by a variety of symptoms such as disorientation, difficulty to focus, and memory issues. Other neurological symptoms include depression, anxiety, headache, sensitivity to bright lights, scents, sounds, and even touch. All of these fibromyalgia core symptoms might vary in intensity and fluctuate over time. I am going to share with you an important, potentially life-saving caution in a moment for early diagnosis and recovery. Many people have many of the symptoms like depression, chronic fatigue for years, often quite severely. And until the pain sets in, they don't realize it's fibromyalgia. So fibromyalgia may suffer from things like imbalances of gut, SIBO, hypothyroidism, autoimmune disease, endometriosis, adrenal fatigue, and irritable bowel syndrome. The nervous system, immune, gut health, and endocrine dysfunctions are all linked up. With the list of fibromyalgia symptoms being so long, it's easy to see why many people feel judged as hypochondriacs and sadly are often accused of making the symptoms up mentally. Let me assure you, they are really suffering without any solution. How to diagnose your intensity of fibromyalgia? The leading factor required for a fibromyalgia diagnosis is overall pain throughout your body for at least 3 months. To meet the criteria, you must have pain in at least 4 of these 5 areas. Left upper part, which includes shoulder, arm, or jaws. Right upper part, which includes shoulder, arm, or jaw. Left lower part, which includes hip, buttocks, or leg. Right lower part, which includes hip, buttock, or leg. Axial part, including the neck, back, chest, or abdomen. How do you find what is the intensity of fibromyalgia symptom? There are 2 criteria. One is widespread pain, known as WPI index, based on which area of body is affected. Here is the visual diagram I have shown the areas affected. You can download the chart from the description and tick mark on the areas affected to create your own score. There are 19 areas in the chart. Wherever there is slight, middle, or even more pain, just tick mark. More than 5 to 7 tick marks indicate that fibromyalgia is there. The second score we have to look at is the symptom severity score, known as SSS. Example, gluten sensitivity, hypothyroidism, pins and needles. So I have listed all of them in this chart, and you give the score between 1 to 3 for each symptoms in the chart. 1 for less symptoms, 2 for middle, and 3 for severe symptoms. And make total of this. If the score is more than 3 and WPI score is more than 5 to 7 consistently for 3 months, then this is the confirmed diagnosis of fibromyalgia. Please download and do your own self-analysis. I have actually given a link in the description. Remember, this is only given for the purpose of education and not the replacement to any doctors.